TMJ is basically an imbalance between the muscles, the joint, and the teeth. If one of these three systems is out of alignment, we have an increase in muscle activity, we have an increase in stress and grinding, and now you have clicking, popping, you can have pain in the joint. If the disc is not in proper relationship and the joint is basically rubbing bone on bone, you can have degeneration of the joint. Degenerative joint disease is what it's called. And these patients get to a point where they literally can't open their mouths, 25 millimeters or so. They can't functionally chew in a proper relationship. This leads to further destruction of the teeth, further aggravation of the muscles, and it's just a vicious cycle.
When you're talking about a patient that's looking for a nicer smile, most of the time our patients are looking for aesthetics. They're looking for, their aesthetics to look better. However, they're not really seeing everything that we're seeing, the worn down teeth, the years of grinding, the years of maybe they have been in pain, they've had migraines, they've had cervical issues, whatnot. So in addition to restoring our patients' aesthetics and having them, have a beautiful smile, we're also dealing with the underlying issues of pain and whatnot that a lot of people may not even realize are associated with their bite and associated with their mouth.
There's a sweet spot with the jaw relationship. We can measure muscle activity, we can relax muscles, we can find an optimal relationship and allow the joints to decompress. We can track the way the jaw opens and closes in real time. And if we allow the muscles to relax, if we allow the joints to decompress, we can find where the body wants to be, and then we can record where the teeth need to be to support the joint in a healthy, balanced relationship. People with TMJ disorders, we offer definitive non-surgical treatment. The process that we take is a step-by-step process. We don't do any definitive work until we've shown the patient, until we find out that this system can be relaxed, we can get them into a healthy, comfortable position, and then it's simply a matter of maintaining that position. And patients don't want to go through surgery. They don't want to go through 10, 12 weeks of where their jaws are wired and they're fixated and there's no guarantee that they're going to get the kind of result that they're looking for. Depending on the individual, we can get them out of pain over the course of 2 weeks. And we do that with a removable splint. We want to make sure that we have a proper diagnosis, and we want to make sure that we are able to get them comfortable before we do anything more definitive. Some patients will choose to use removable appliances to help them maintain comfort, and other patients decide that they don't want to use appliances for the rest of their life, and then we restore the teeth in a position to support the joint in a healthy relationship. Now, unfortunately, as we go through that, I've got to give someone a beautiful smile to get to that result. And I've been brought to tears when we finish a major case where someone has suffered from TMJ for years and years and years, has a broken down bite, smile that's extremely compromised, they're in pain all the time, and we get to the final stage and they get up and they look in the mirror and their pain is gone, everything is comfortable, and now they're looking at this beautiful smile. This is what we do. This is where our passion lies.